My name is Joe Peroni, and this is the Rise Above Project. And today we're going to talk about one of my favorite subjects, and this is the relationship between exercise and mental health. Now, I'm extremely passionate about this subject, and I have been most of my whole life. Starting when I was 8 years old, I was in organized sports. By the time I was 12 years old, I was already on a daily regimen of working out, which included weight training. By the time I was 14, I completed a 26.2 mile marathon race. At 15, I did my first bodybuilding show. At 17, I won my first bodybuilding show. And from there, I've been doing various bodybuilding shows all the way into my 50s, and I'm 58 years old at this present time. And I've been a personal trainer, and I've made my living at that since about the mid-1980s. In addition to all that, I am also a licensed marriage and family therapist. So going with that, I do think that I have enough experience, I have the credentials, and I have a degree of expertise, being that I've been working on this for like 40 or 50 years now. So I have a lot to say about this subject. And I have a lot of experience in dealing with the social aspect of it as well. When we're looking at the relationship between exercise and mental health, for most of my life, and I know things are changing now, and they have changed a lot, but throughout most of my life, especially, not just with exercise, but with if you're moving towards the bodybuilding realm, I've been told things that I've been self-centered, I'm conceited, selfish, antisocial even, and of course they throw around the word narcissism. And this doesn't just go back to my childhood. I was in graduate school trying to obtain my license in marriage and family therapy, and even then with teachers that should know better, they also would throw around the term narcissism for a person such as myself who worked out a lot and did a lot of bodybuilding shows. They see paying attention to your body as one thing, and they see mental health as something completely different. And if you pay too much attention to your body and to your physical health, they think that there's some type of narcissism involved there. And I just did my own thing throughout most of my life. I'm not going to say it didn't hurt in some way, shape, or form. But the other thing that people also said a lot is that if you work out, you have a tendency, or they have a tendency to think that you're an airhead or a musclehead, or you're just stupid and you're just not a smart individual because you work out a lot, you look a certain way, therefore you have to be a person who's very unintelligent. And well, after obtaining 3 college degrees, I don't know if that's so true, and so I was always going counterculture to what was going on. And wouldn't it be nice, wouldn't it be beneficial if there was actual evidence and data that could really prove one way or another the relationship between exercise and mental health? And maybe it's not so negative as so many people throughout my life had maybe believed that it was. Well, I wouldn't be doing this show if there wasn't a tremendous amount of evidence now. Now, whether people pay attention to it is another story or not. But let's take a look at some of this evidence, because there was a recent study from the British Journal of Sports Medicine where they analyzed 97 meta-reviews, which included 1,039 random controlled trials, which included 128,119 participants or subjects. Very extensive. Now, when you read these studies, typically, almost always, what happens is at the end of the study it says, this study or this information, it indicates, it suggests, it implies. Basically, they're afraid to make any declarative statements about anything. They certainly don't want to say that the evidence proves anything. They always want a lot of wiggle room. However, I am going to tell you what the conclusion of all of these studies are when it has to do with exercise and mental health. And this is what they say. There's 3 major conclusions. Number one, exercise is the most beneficial mental health treatment. Period. Number two, physical activity is 1.5 times or 150% more effective at treating depression, anxiety, and stress than medication or psychotherapy. Period. Who's laughing now? I've been correct since I was 8 years old. Number three, exercise should be the first choice in managing depression, anxiety, and stress. And I'm having so much fun with this because I knew I was always right since I was a little kid. Let me read that third one again. Exercise should be the first choice in managing depression, anxiety, and stress. End of show. It proves it all, right? But let's take a little bit of a deeper dive into this. Let's compare exercise with psychotropic meds and see what we come up with. So number one, exercise is cheaper than psychotropic meds. Exercise has less side effects. And you could also say it has no negative side effects. Do psychotropic meds have side effects? Absolutely yes. Exercise. It improves physical health, such as you can keep a healthy body weight. Do psychotropic meds help you keep a healthy body weight? No. A lot of the complaints is it helps you to retain water and to gain fat. So again, exercise wins. Continuing, exercise helps you to increase bone strength and muscle strength. Psychotropic meds do that? No, does not. Exercise also helps you to increase your cardiovascular health. There's cognitive benefits, and it also increases your sexual health. Do you think psychotropic meds helps your cardiovascular? Do you think it increases your sexual health? As a matter of fact, it makes it worse. And what do you think all that does? It decreases your self-esteem as well. So we'll talk about that in a second. So in a head-to-head battle, exercise absolutely blows psychotropic meds out of the water. You know who doesn't like that? Big Pharma. We'll get to that later too. So let's have a head-to-head contest now with working out, bodybuilding, or whatever else you prefer to do in terms of exercise. Let's compare that to psychotherapy. And keeping in mind, I also make a living as a psychotherapist, so I do both. I think you should do both. So as we compare it to talk therapy, turns out that exercise is cheaper. It also turns out that the lived experience is premier. It's absolutely the most important thing you can do. It's much more beneficial than talking to somebody for an hour in a room. Now, there's 168 hours in a week. How much do you think somebody's going to turn their life around in 1 hour talking to somebody? Without any action, how is somebody going to actually feel a sense of accomplishment? The answer is that they don't. It's great to do psychotherapy, but if you don't take it out into the field or into the world and actually have a lived experience and do that and try your best, you're not going to go anywhere. So once again, exercise wins. Exercise increases your self-esteem. In talk therapy, we try to talk people into having self-esteem. How well does that work? Now, I'm not a believer in positive affirmations, but a lot of therapists are. Positive affirmations don't work, especially without any type of action. You can't lie to yourself. You're definitely good enough. You're okay. You're lovable. You're great at whatever you're doing right now. Hold it. Is that an honest assessment? It could be, but probably not. Probably that somebody needs to do a lot of work to get better. And if you don't get hired for a job or whatever it might be, or you don't make the certain sports team, are you good enough? No, you got to go back to the drawing board. Again, physical exercise, working out, sports is a lot more conducive to creating a healthy adult than having these positive affirmations, telling people that they're so great and they don't have to do anything to get any better. You know, you're great just the way you are. Well, maybe you are, hopefully. But most people aren't. And so, again, that's a big lie. So do positive affirmations work? No. So again, working out will destroy psychotherapy in a head-to-head competition. Exercise also positively affects the neurochemicals in the brain better than therapy does. So when we improve our neurochemicals, what does that do? Well, it decreases the inflammation in our body. It helps to improve overall mood. It increases your immunity, increases your cognition. Going back for a second, do you really think that talk therapy decreases the inflammation in your body? Do you think it improves your immune system? No. Also, working out, again, sports, physical activity, it has a way of decreasing somebody's social withdrawal. Think about this. One of the major problems that we're working with in this country right now is that a lot of young people are just sitting on social media all day and they're playing video games. And then they get sent to a therapist. There's a wide divide there of how you're going to help this person do this when they have no action in their life, they have no social interactions, they have no self-esteem, and the only action they get is playing video games. So this is going to be a very difficult thing to change these people. Again, if we got into sports at a much younger age, I think we'd be much better off. You know, there's sometimes that it happens where, especially in the summer now that I'm doing therapy on a lot of people, let's say young people, and somebody says, well, I might have to have my kid miss the session because they're going to a birthday party or they got invited to a pool party. And I'm like, listen, by all means, have your son or your daughter go and enjoy a July 4th party. Go have them enjoy a pool party. Have them be interacting with friends and family. That's way more beneficial than having a talk with me is going to do. I mean, I tend to think that I'm really good at what I do, but nothing is going to beat the lived experience of being around human beings. So again, they have to live a life. So as we go along with this, some of the people who are listening to this are going to think this is great, all right, for all the reasons that I told you. But there's some people that are going to hate it. And the people that are going to hate it are, like, say, Big Pharma, because they don't want to know that all these drugs in the world, these billionaire companies, actually, they can almost disappear overnight if people did the right things. That's number one. Number two, a lot of these psychotherapists, such as myself, they don't usually work on the other side of the field in terms of exercise and human development and personal development like I do. And this is one of the reasons why it's really interesting how life coaches today are just, in terms of business, are destroying psychotherapists because they deal with trying to have people go out into their real lives in the field and to push and to do things. So in terms of life coaching, there's a lot of people that are business people, for example. And so I think that unfortunately, they tend to get much better results than a lot of psychotherapists do. And so we're seeing this over and over. The other thing that's important here is the American Psychology Association. Now, let's not fool ourselves. They're a governing agency or a body, and they want to maintain their power. They want to maintain their relevance, and they want to maintain their cash flow. And so what do they think about all the evidence that exercise is actually better than psychotherapy? And it's better than drugs. So we're canceling out psychiatrists and a lot of other mental health clinicians. I'm sure the American Psychology Association is not too thrilled about that. And guess what? They're not. Here's something from the American Psychology Association. They emphasize drugs, they emphasize psychotherapy, and they believe that exercise is an alternative approach. And that exercise, there is no evidence of exercise as a treatment plan for anxiety, depression, stress, or any other type of mental health issues. That sound like it's based in truth and science? No. So what they're actually pushing is something that's 100% false. And this is what's also not being very helpful to the general public here. As a matter of fact, there is a ton of evidence right now, you could say a preponderance of evidence, that will tell you that exercise, yoga, acupuncture, and actually being in theater is more helpful to treat PTSD than psychotherapy and medication is. That's something else the APA doesn't want you to know. Keeping in mind, again, I have a license as a marriage and family therapist. So these things are very important to know. So knowing this, would you not consider that exercise should be a part of your plan as a human being in your everyday life? Now, I'm not going to get into this too much in this particular show, but again, I do a lot of therapy with a lot of young kids, and these kids, they typically have no self-esteem, they have no interest, no drive, no ambition. And do you know how difficult it is to get them to do anything these days? Because they're using video games, they're using social media like it's some type of pacifier, or they're using it as a substitute for the mother's breast. You know, they just don't want to grow up in any way, shape, or form. They're afraid of the real world. A conversation could go somewhat like this, especially now that this is the summer, and I'm getting a lot of these kids that just sit in their room all day and they do nothing. I'm like, this is summer. You got all the time in the world to go out and play and do all these physical activities. And they'll say, well, I can't join a gym because it's too expensive. Maybe that's true, but a lot of the commercial gyms today, they charge $10 a month. And it's like, well, is that too much money? Well, on one side, $10 is a lot of money if you have no money. But then again, if you spend $10 to $20 on cheeseburgers every week, I think you can afford $10 a month for a gym. Right? So it's about priorities. That's really what it is. It's about choices. It's about good decisions. Also, if they say, well, listen, there's no way I can make it to a gym. I can't do that. The gym is like a mile down the road. I don't have a car. Okay. Can you walk there? Because why would you go to a gym and walk on a treadmill when you can actually walk to the gym in the first place? Keeping in mind that when I worked out, and I was about 12 years old, I did work out in my own bedroom with some weights, but there were times when I went to the Freeport Recreation Center, which was 3 miles down the road. So I would run 3 miles to the gym, work out, and run 3 miles back. And that's when I was 12 years old. We're talking about young kids today, let's say they're 10, let's say they're up to even like 23, 24 years old that I'm getting. And they can't walk a mile down the road to go to the gym. What's going on? I don't get it. You know, and then it's like, okay, I'll give in. I'll say you can't make it to the gym. Totally understandable. When it's actually not, but let's say it is. And I'll say, well, look down at your feet. Do you see a floor? They'll say, yes. I say, great, you have a floor. Can you do push-ups? Can you do sit-ups? Can we do calisthenics? Oh, well, you caught me. I don't really want to do any of those things. It's like, well, and there it is. And this is why it's very, very difficult, even when you're in the business, as let's say me as a licensed marriage and family therapist, that if I'm moving towards people to do exercise as a treatment for anxiety, depression, stress, low self-esteem, things like this, it's very hard to do because they've already been trained for so many years to do nothing, because now these kids are being born into this social media society, and it's very difficult to make them change. So we have to get a hold of them at a very early age. So let me leave it at that, because I don't want to act like I'm making fun of kids too much, but I'm just saying that it's, again, you cannot talk an adult or a child into being motivated. That doesn't happen. You can't talk somebody into being inspired. Arnold Schwarzenegger said it a long time ago, is that he learned the art and the science of hard work by wanting to be a bodybuilder at a young age. In other words, somebody didn't say to him, his parents didn't say, hey, Arnold, you have to learn to love hard work. Like, that makes no sense to people unless they have meaning and purpose and they want to do something. And if that happens, let's say you want to play a guitar. You don't have to tell a young person to play a guitar for 12 hours in front of a mirror. They'll do it naturally because they want to do it and because they're interested in it. So again, it takes action. So let's take another look at psychology again from a slightly different angle here. When we're thinking about, let's say, the 5 personality traits, we can look at these traits, right? They tend to be, or what we think of them as, is permanent, they're pervasive, and they're impervious to therapy. In other words, you're born with these personality traits, and there's very little you can do to change those personality traits. And that's generally considered to be the truth in terms of psychology. And therefore, you can't really do therapy on somebody to change their personality, at least at a very deep level. But is that true? I don't know. Again, let's add in, or let's prescribe exercise, sports, weight training to that. So what happens in these big 5 personality traits when we inject exercise into the mix? Well, let's take a look at the first one. So we have conscientiousness, doing the right things at the right time, being dependable. It turns out that when somebody enjoys doing something, they want to do it more, and then they make time for it. And then they learn how to optimize it, how to do it better. So what happens? They become conscientious. They start worrying about their nutritional program. And by the time a kid is, say, 15 years old and interested in this, they could tell you about protein, carbohydrates, fats. They can tell you how many calories are in each food, and they become amazingly conscientious. I thought psychology cannot change somebody's personality traits. Seems like maybe that could be wrong. Let's continue. The personality trait of agreeableness. It turns out that when you work out and you exercise and you feel good about who you are as a person and you feel more confident, not just in how you live your life, but how you look, it turns out that you are not so angry and disagreeable and cantankerous. You tend to be a person who is more of a go with the flow kind of person. You don't have to try to manipulate and coerce people and be angry and tell them how you disagree with them. You don't care that much. You're living your life and you feel good. So it does increase your agreeableness. How about neuroticism? Well, again, it turns out that when you work out, exercise, and feel good, that you're less emotionally dysregulated. Because again, the happier you are with who you are, you tend to be nicer, not only to yourself, but to the people around you. So the people who are typically neurotic, that can't control their anger or their emotions and things like this, they tend to have a lot of inner turmoil going on, and then they spread that to other people. So again, can this be changed with working out, exercise, and maybe joining a sports team? Absolutely yes, of course. So let's talk about openness to experience. Again, it turns out when you like yourself and you have self-esteem and you feel good and you've been through some adversity, because in sports or in exercise, you learn how to fail a lot, and then you come back and you want to do better. And you learn that you're more open to different experiences, because it doesn't matter if you lose. It doesn't matter if you're not good at something, because you know if you try hard, you will be better. You may not be the best. You may not have the genetics to be the ultimate superstar, but you do know that you can get better with some time and some effort. Therefore, you become more open to experience. And extroversion. Take it from me, somebody like myself, I am extremely introverted, but I have the capacity for extroversion. And how did this happen? Well, again, starting with exercise and sports and working out at a young age, I feel good about who I am, and therefore I'm confident in certain areas of my life. and it could spread to other areas of my life. So I do have the ability to be more extroverted. I'll give you an example. In 7th grade, I had to do a speech in front of the class. We all did. And I was scared to death. I didn't want to get in front of the class. There was no way. I think the speech was supposed to be 5 minutes. And 5 minutes of public speaking might as well be, the rest of my life. I hated it. But they said you could talk about anything you wanted, and typically it would be even better if you could do a demonstration. So I didn't know what to do. So what I did was I brought in 2 dumbbells, and I proceeded to talk about one of the very few things I knew anything about, which was, well, at least I thought I knew when I was in 7th grade. I was like 12, 13 years old. But as it turns out, I enjoyed it. And the students would ask me questions, and the teacher asked me a couple of questions. And I actually felt I had some degree of competency there. And so I was able to show a level of extroversion when I'm not extroverted. It also helps in situations where, and I think Arnold also said this in his first book, it's called The Education of a Bodybuilder. He said if you are shy, if you're introverted, but you start to work out and you have a degree of competency and you do well and you look good, you can use your body and what you do as a conversation piece. People are going to ask you about it. They'll ask you, what do you eat? How do you work out? What do you do? And that became really interesting because if you have any awareness at all, the number one subject you should know about is about yourself. So even as a very young kid, people would ask me about working out, why I did it and how I did it and things like this. I would be able to have that conversation. And it led me to start to be able to see the other person and then ask them questions about themselves. And so I developed friendships this way. And I don't know if I would have been able to really do that as easily as a very shy kid, very introverted kid, if I didn't have a conversation piece, such as my ability to play sports and do bodybuilding and things like this. I don't know if it would have been as easy as it was. So again, to go over this really quick, here's your conclusions. Exercise is the most beneficial mental health treatment you can do. And it also does make a difference in the big 5 personality traits: conscientiousness, agreeableness, neuroticism, openness to experience, and extroversion. I cannot think of any negatives that would come along with exercise. So I hope this show is beneficial to you in some way. My name is Joe Peroni. This is the Rise Above Project. I have to end this show because I have to get my second workout in for the day. Please subscribe and tell a friend. Thank you.